I'm Annette Pasternak, the Stop Skin Picking Coach, and today you would like a test to determine whether you have dermatillomania. The formal name for what is very commonly called dermatillomania is excoriation, parentheses, skin picking disorder. Sometimes just called skin picking disorder, chronic skin picking, compulsive skin picking, again, dermatillomania. There are a lot of different names for this. As far as how do you know you have it, other than just telling you like if you feel like you have it, you probably have it, we're gonna go through a little test. This is based on the Diagnostic and Statistical Manual for Mental Health Disorders, or DSM-5, because it's the 5th edition. This is what mental health professionals use to diagnose mental health disorders, of which excoriation, parentheses, skin picking disorder is one. It's been classified as such since only 2013. So now formally you would need to see a psychologist, psychiatrist, clinical social worker, a mental health professional who is able to diagnose you. However, most of these questions are fairly straightforward, and so you can really just read them and ask yourself these questions. So these are not stated as questions in the DSM-5. They are just statements, but for this test, we're going to turn them into questions. The first question is, do you engage in frequent skin picking resulting in lesions? Wounded skin, basically. The second question is, have you tried to stop repeatedly? I'm guessing since you're looking for this video that you have tried to stop repeatedly. Usually if something's just a problem that happens to us once, we're not that concerned. It's that you have tried and tried to stop. Number 3 is, does it cause you significant distress or impair your ability to function? So maybe you are late for work sometimes because of it. Maybe you don't go and socialize normally because of it sometimes. That would be impairing your ability to function, but it is an or thing. So just the fact that it causes you significant distress, that is enough to put you in the camp of, yes, you do have this. If it causes you significant distress, like you're upset about it a lot, especially after you do the behavior, right, really badly. Number 4 is your picking not caused by a substance or a medical condition. So there are some medical conditions that can cause you to be picking. So it is good to know that if that's the case. There are also substances like drugs, okay? So methamphetamines are well known to cause this. Even properly prescribed ADHD medications sometimes cause this behavior. However, a lot of times when people stop those drugs, they still continue picking. So at that point, even just because it was caused by that, I wouldn't say you don't have it, even if it was caused by the drug. But that is what the DSM-5 says. Now, number 5 is your behavior better explained by another psychiatric disorder? For example, psychosis can cause people to think there's something there that they end up scratching or picking at, or possibly body dysmorphic disorder, where your skin is really fine, but you think it's not fine, and picking is a result of that. But even that probably would want to be treated also from the point of view of the picking itself, using those kind of tools and techniques rather than just the body dysmorphic disorder, or BDD. But that is the number 5 is kind of the trickiest one, where this breaks down, these 5 questions break down a little bit as far as a self-test goes, because really it's probably better for you to go see a mental health professional and get diagnosed. But this is a way for you to tell, really, is it likely that they are going to diagnose you with this? Just a good way to get a handle on, like, okay, do I have this problem for real? Like, is it to the level of a disorder? All right, I hope you found that helpful. Regardless of what you come up with there, If you do pick your skin and you want to stop, I have lots of videos telling you how. If that interests you, please subscribe to my channel, and definitely if this was helpful, give it a thumbs up.